Hello everyone, my name is Eldrika Glover Hill, and today we will be talking about the education process. The learning outcomes will be that the MSN, student nurse educator, will be able to identify the steps in the education process, identify the differences between teaching and instruction, understand the behavior and growth changes that occurs with learning, and understand how nurse educators are influenced by educational theories. The education process is a planned course of action. It involves teaching and learning. It involves two individuals, which are the teacher and the learner. And both the teacher and learner must understand the needs of the process is a two-way communication. It involves growth between the teacher and the learner, and is much like the nursing process. And so this is experienced most of the time when we start our formal education. We agree to be submitted to a program for learning, for instruction, knowing how to do our skills correctly, and this is mostly done throughout our nursing course. And so the education process has different steps, much like the nursing process. They have assessment, where we identify our learning needs, our readiness to learn, and learning styles. This is, of course, accomplished through self-assessment, It can be accomplished through peer assessment and just assessment of our teachers overall. Planning is developing a teaching plan based on outcomes to meet individual needs. This involves helping students learn how to critically think and understand the basic principles in nursing. An example I can give is with creating a care plan of how we can take care of our patients. Implementation, performing the act of teaching using specific instructional methods and tools. And this is accomplished by testing new ideas. It is accomplished in lectures, skill lab, and tests where the teacher actually evaluates how well we learn. Evaluation. This is determining behavior change, outcomes and knowledge, attitudes and skills. This can also be done through tests that are administered, surveys, and feedback from students that have also graduated from the course. Teaching versus instruction. Teaching is the instructional activities used to identify student learning needs, readiness to learn, and learning style. This is mostly done in the classroom setting, or it can be done in skills lab, computer labs. It can also be done as we go out in the clinical setting with students. Instruction is the component of teaching skills that utilize cognitive, psychomotor, or the affective domain. And this is pretty much experienced with developing a care plan. So I'm going to give an example. You have a patient who's taking the medication Lasix. So in formulating a care plan, the cognitive will be that the client will explain the side effects of Lasix. Affective, the client will share feelings of taking the medication. And psychomotor, the client will practice new ideas that affects behavior. This can include things like checking their daily weights, monitoring their progress. Okay, so learning, the action by which skills, knowledge, and attitudes are acquired to alter behavior. Now, with the previous example I just gave, this can be measured by that person actually making behavior health changes, managing their heart failure, doing things such as reducing their weight, reducing their sodium intake. And these are things which can be taught by the student. So the paradigm shift have focused on increasing technology and nursing science. Educational theories are embraced by nursing educators and are adopted based on the mission of schools. Theories such as realism are applied to nursing education, which focus on the existence of knowledge and development of the mind. So nurse educators are shifting from teacher-based curriculum to more student-centered learning. This is driven by technology, evidence-based practices, This all helps promote critical thinking and problem solving. So in summary, we learned that the education process has 4 steps. We learned that teaching and instruction go hand in hand for learning needs. Our goal as educators is to promote behavior and growth changes that occurs with learning, and that nurse educators are influenced by educational theories that can help shape and change the future of nursing. And that concludes our presentation. Attached, you will find a list of all of our references.